Hey, it's Joshua Kanji here. Now I'm going to show you how to test the cranial nerves and what their purpose is. Okay, so the first nerve we're going to be testing is cranial nerve 1, or the olfactory nerve.
So the way we're going to be testing the olfactory nerve is through a sense of smell test. And the way we're going to be doing this sense of smell test is that we're looking for if the patient's sense of smell is intact. So what I'm going to do first is ask my patient to close their eyes. Can you please close your eyes? And so I'm going to ask them to breathe in a object with a type of smell, and don't make the object like a stinky object to not elicit a gag reflex from them. So basically what I'm going to do with this object is I'm going to put it underneath the patient's nose. I'm going to ask you to breathe it in. Can you breathe it in for me? And do you know what that smell is?
Yeah, vanilla.
Okay, so it is vanilla, so that means that the patient's sense of smell is in fact intact.
Okay. So the positive sign for this test, or the olfactory nerve test, was that the patient was successfully detecting an odor and identifying the smell. A negative sign would mean that the patient would not successfully smell the object, which would mean that their sense of smell is not intact. Okay, so the next nerve we're going to be testing is cranial nerve 2, or the optic nerve.
Okay, so for the first test of the optic nerve, we're going to be doing a confrontational visual field test, and we will be looking at the patient's peripheral vision. So to conduct this test, we're going to have the patient stay arm length away from us, and then we're going to ask the patient to cover the right eye. Can you cover your right eye, please? And at the same time, we're going to cover our left eye, which is the same side as their covered right eye. And so basically, we're going to have them stare at my eye real quick. Can you stare at my eye? Good. And we're going to place fingers on their upper and lower fields of vision, conduct to see if their peripheral vision is good. Are you ready? All right.
1.
Good.
3.
Good. All right. Can you cover your left eye for me, please? All right. And shift yours to the right eye. All right. Ready?
4.
Good.
3.
Good.
All right. So for the first test for the optic nerve, a positive sign would indicate that the patient can correctly see and identify the number of fingers I was holding on my hand. However, a negative sign would be that the patient could not see the fingers correctly or identify how many fingers I was holding up.
Okay, so for the second test for the optic nerve, we're going to be testing or looking for the patient's visual acuity using a Snellen chart right here. So to conduct this test, we're going to have the Snellen chart, which I already have one hanging 20 feet away from the patient. And so what we're going to be first doing to the patient is that we're going to ask him, do you wear glasses or contacts?
No.
Okay, so he doesn't wear glasses or contacts, so we're going to ask him to cover their left eye. Can you cover your left eye, please? All right, and so I'm going to ask the patient to read the lowest line that they can see. Can you read the lowest line for me, please? Which is line what?
7.
7? Okay.
Actually, no, 8. Sorry.
Okay.
DEFTPOTEC.
Okay. Can you cover your right eye for me, please? All right. Can you read the lowest line you can see?
DEFPOTEC.
Okay. Don't cover any eyes. Which is the lowest line you can see? Line what? 8?
9th one.
9th one? All right.
LEFODFCT.
All right.
Okay, for the Snellen chart, or the visual acuity test for the optic nerve, a positive sign would indicate that the patient, like in the previous video, could see line 8, which is what an average person can see with 20/20 vision, which meant that he was standing from 20 feet, and a normal person could see that from 20 feet. However, a negative sign in the test would mean that the patient was not able to read from the line 8 from 20 feet away, and instead read the higher lines an average person would see from like 30 feet away with line 6, or 50 feet away from line 4. Okay, so these next few tests, we will be testing 3 types of cranial nerves. Cranial nerve 3, 4, and 6, which is respectively the oculomotor, the trochlear, and the abducens nerve.
Okay, so for this next test, for the 3 cranial nerves that we're going to be testing, we're going to be looking for any involuntary shaking of the eye in the patient, or also known as nystagmus. So this test we're going to conduct, it involves a pin light. So what we're going to do is we're going to take the pin light and we're going to move it 12 to 14 inches away from the patient's head, and we're going to ask the patient, can you keep your head still for a moment?
Yes.
And so basically we're going to have them follow this pin line with their eyes, and we're going to be moving this in the 6 cardinal fields of gaze to test. Ready?
Mm-hmm.
Okay, so there was no involuntary shaking of the eye.
Okay, so for this first test for cranial nerves 3, 4, and 6, a positive sign would mean that the patient's eyes were showing no signs of involuntary shaking of the eye or nystagmus. However, a negative sign would mean the patient was showing involuntary shaking of the eye, which does in fact mean that they have nystagmus.
Okay, so for the second test, we're going to conduct it in a dimly light area like this one. And basically for the second test, we're going to be testing how reactive the pupils are to light. So to do this, we're going to have the patient look at a distant object, look at any distant object from afar. This will help the pupils be dilated or become dilated. And so what you're going to do with this pen light here is you want to shine the light to the side of their eyes first, starting with their right eye. So keep staring at the object, please. All right. Make sure that the eye constricts when you shine the light. All right. Keep staring at that object.
Okay, so for this second test for the 3 cranial nerves, a positive sign would indicate that the pupils did in fact constrict, like in the experiment or the test I did in the previous slide. It constricted to a normal size in response to the pin light, but a negative sign would indicate that the patient's pupils did not in fact react to light by constricting, and instead stayed dilated even when there was light being shown in their eyes, which could mean that they have a brain injury or a disease in the eye.
Okay, so for the third and final test for these 3 cranial nerves, we're going to be testing for the accommodation of the pupils. So for this test, we're going to be looking for if the eyes cross or not when a farther object begins, their eyes begin to cross when a farther object begins to come closer to them. So what we're going to do first is that make sure you're in a brightly lit room like this one, and we're going to have the patient stare at a distant object in this room. Can you stare at one? All right. So, and then as they're doing this, you want to take the pin light and make sure that they revert their attention to this pin light. Can you put your attention to this pin light? You want to, and once you do this, you want to put the pen light towards their nose and check to see if their eyes cross.
Okay, so for the third and final test for cranial nerves 3, 4, and 6, a positive sign would indicate that the patient's eyes did in fact cross like they were supposed to in response to the oncoming pin light as shown with the patient I conducted it with. However, a negative sign would mean that the patient's eyes did not properly accommodate by crossing their eyes. Okay, so for this part, this concludes the tests for cranial nerves 3, 4, and 6, and there is a special acronym associated with these tests, which is PERRLA, which means that the pupils are equal, round, and reactive to light, and accommodate, which is proven through these previous tests. The next nerve we'll be testing is cranial nerve 5, or the trigeminal nerve.
Okay, so the way that we're going to be testing cranial nerve 5 or the trigeminal nerve is that we're going to be looking for any signs of weakness in their facial sensation, the patient's facial sensation. So what we're going to have them do first is you want them to clench their teeth and bite down. Can you clench your teeth and bite down? Thank you. And while they're doing this, you want to palpate the masseter muscle right here in the jaw. That's good, that's good. And then at the same time, or after this, we're going to palpate their temporal muscle up here on the side of the forehead. Good, good. And then after this, we're going to put your hand underneath the patient's mouth, and we're going to put some resistance, and we're going to ask the patient to open the mouth. Open your mouth. All right, good, good. All right.
Okay, so for the trigeminal nerve test, a positive sign would mean that the muscles in the jawline, the masseter muscle and the temporal muscle, did in fact properly flex in the way they were supposed to, and there were no abnormal feelings, and the patient showed no signs of weakness when pushing their mouths against the resistance. A negative sign would indeed in fact be that the muscles you were feeling were abnormally flexed and you could feel something abnormal in there, or that the patient showed any signs of weakness when pushing against their mouth when they were trying to open it. The next nerve we're going to be testing is cranial nerve 7, the facial nerve.
Okay, so to test the facial nerve, we're going to be first looking for any abnormal drooping in the face and or weakness in facial expressions as we're testing them. So what we're going to have the patient do first is that I want them to close their eyes tightly and open them. Thank you. Can you smile for me? Can you frown? And can you puff out your cheeks? Okay, good.
Okay, so for the facial nerve check, a positive sign would mean that the patient performed all the actions with ease, which meant that the facial nerve was indeed intact, while a negative sign would mean that the patient showed signs of difficulty when performing one of these actions. Okay, the next nerve we're going to be testing is cranial nerve 8, or the vestibulocochlear nerve.
Okay, so for the test of the vestibulocochlear cranial nerve or cranial nerve 8, we're going to be looking for any problems in the patient's hearing. So what we're going to do to conduct this test is we're going to occlude one of the patient's ears right here, and we're going to whisper something on the other side of their ear, or the other ear. So make sure you whisper only like 2 words is fine. All right. Banana pie.
Banana pie.
Good.
Strawberry cupcake.
Good. All right.
Okay, so for the vestibulocochlear nerve test, a positive sign would mean that the patient successfully identified what you said or whispered indirectly through their ear, which means they have no signs of any loss of hearing. However, a negative sign would be the opposite of that. The patient did not hear any of your whispers, which means that they had difficulty hearing or they were experiencing loss of hearing. The next nerve is cranial nerve 9, or the glossopharyngeal nerve.
Okay, so for the test of the glossopharyngeal cranial nerve or cranial nerve 9, we're going to be using something called a tongue depressor. And with this, we're going to be looking for if the uvula moves up when sticking this tongue depressor there, and if the patient responds to pokes behind their mouth with a gag reflex. So what you're going to do first is use this tongue depressor, and you're going to have the patient say ah. Open your mouth and say ah.
Ah.
Ah. And then while you're doing this, you want to see if the uvula moves up.
Ah.
All right, good, good, good. All right, so the uvula did in fact move up, and after this, you want to test the patient's gag reflex. So you want to keep your mouth open for me. Say ah.
Ah.
And I'm going to stick the tongue depressor towards the back of your mouth and tell me when you gag. Okay, that's good. Good. That's a good reading.
Okay, so for the test for cranial nerve 9, or the glossopharyngeal cranial nerve, a positive sign would mean that the patient's uvula did in fact move up and they responded with a gag reflex, when the tongue depressor went down their mouth. However, a negative sign would mean that the patient's uvula did not react to the tongue depressor when they said ah, or they did not respond with a gag reflex when the tongue depressor was stuck inside their mouth. All right, cranial nerve 10 is going to be the vagus nerve.
Okay, so for cranial nerve 10 or the vagus nerve, you should have been looking for any hoarse in their voice, and if they could swallow or not through these previous tests.
Okay, so a positive sign with the vagus nerve test would be that the patient responded with normal speech and could swallow throughout these whole tests, while a negative sign for the vagus nerve would mean that the patient responded with a hoarse voice and they could not swallow or were unable to speak throughout these tests. The next nerve we're going to be testing is cranial nerve 11, or the accessory nerve.
Okay, so for the accessory nerve or cranial nerve number 11, we're going to be looking for any weakness in the muscles it supplies. So what we're going to have the patient do is that we're going to have their head move side to side. Can you move your head side to side? All right, now next up and down. All right, and can you shrug your shoulders for me? Resistance. All right, good.
Okay, so for the accessory nerve test, a positive sign in the patient would indicate that they performed these tasks with ease. However, a negative sign would show that the patient showed weakness doing one or more of these actions, whether it be the turning their head side to side, up and down, or shrugging their shoulders. Okay, so the last nerve we're going to be testing is cranial nerve 12, or the hypoglossal nerve.
Okay, so for this last test, we're going to be testing the hypoglossal nerve or cranial nerve number 12, and we will be looking for any atrophy or any weakness within the tongue. So what we're going to have to do is have the patient stick out their tongue, and can you move it side to side?
Okay, so for the testing the hypoglossal nerve, or cranial nerve 12, a positive sign would mean that the patient experienced no difficulty sticking out their tongue and moving it side to side. A negative sign would indicate the opposite of that. The patient was indeed experiencing difficulty moving their tongue and showing signs of atrophy or muscle thinning. And that is how to test all of these cranial nerves in this, after editing 17 to 18 minute video. It's a very, very long video to make.